Assalamu alaikum, hello and welcome to the Health Show here only on the Islam Channel with me, Alistair Greener. Every week we're joined by a health expert within their specialised field and discuss the prevention of health issues or concerns that we or our loved ones may face. Looking at how we can change our health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show to help guide you in the right direction. And if you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. Today, our topic is general health advice, where we can find out more about why people visit their GP and how often is too often. It's great to welcome Dr Nazia Rashid, a qualified general practitioner, to tell us more. With 9 years' experience, Dr Rashid is involved heavily in health promotion and charity work, both in the UK and overseas. Close to home, she has been on various health committees and has been involved in GP selection assessments for many years. She also champions those whose human rights have been violated, and she aims to portray how British Muslims can contribute positively in day-to-day life. Well, welcome. Thank you so much indeed for coming in. And I know how busy you all are.
Oh, thank you for having me.
So we really appreciate your time. But before we talk more to our GP today, we're going to take a look at how important it is to be on top of your health and the fact that you should visit your GP. An example of this is recently where the White House doctor who reported that Donald Trump's overall health was excellent after the president received a physical exam. Let's take a look.
In summary, the president's overall health is excellent. His cardiac performance during his physical exam was very good. He continues to enjoy the significant long-term cardiac and overall health benefits that come from a lifetime of abstinence from tobacco and alcohol.
Well, Dr Rashid, it was fascinating watching that particular clip. Now, obviously, we're not all as privileged as the president, but just general basic health care is so important, just being aware of our bodies.
Yeah, definitely. I mean, it's really important to have your health assessments if you get called in by the GP, because what we try and do is try and prevent illnesses. And I'm sure a lot of people have heard of the saying, prevention is better than cure. So what we try to do is try and prevent people from having illnesses. For example, if you have regular blood pressure checks done, have your heart rate monitored, you can have your cholesterol done, have glucose done. These are blood tests you can have done as regular health checks. And when somebody turns 40 in the NHS, we offer this service. It's quite a simple test that can be done by a healthcare assistant, and it's really important that as the general public get invited to these, that they come to these appointments. As also, we have smear tests, etc., and screening tests. So that surveillance is very important to keep.
Now, we've got lots we can talk about today,
Yes,
because the
that's true.
role of the GP is huge, and the GP surgery. And one of the things we love to do on this show is do a little bit of myth busting so that people actually understand what is appropriate, what isn't, how the GPs are set up to help. So let's start from the very beginning and talk about the role of the GP within a community. So how does a GP practice actually work?
So within a GP practice, you have a team of people. So people often say, I'm going to the GPs, but you have to realise that it's not just the GP that's at work there. It's a whole team of people, from the receptionist down to even the cleaners. Everybody has to have, first of all, sign a code of confidentiality. So that's very important. For a patient, they might come in, get an appointment, but often if they see a GP, they often need tests, so they might have to see the nurse, or they may need dressings. So as a GP, my role is really just to treat people to the best of my ability, and if necessary, refer them on if they need to, obviously order the investigations that are necessary, and refer them to the relevant services that I think they need.
Now, we're going to talk about the different people within healthcare in the second half, and certainly the role of the pharmacist, who definitely has a role these days. But if you go to your local surgery, say, for example, you've moved to a new area,
Yes.
you find out where your surgery is, and then you need to sign on with a GP. Do you get a choice? Are you allocated someone? Are you able to change surgeries? Are you able to change GPs? How does that all work?
So there are certain rules as to who's entitled to the NHS. I think that's NHS treatment, and that's another debate in itself. But I know that there's a charity I'm involved with which tries to get people who've been excluded from the NHS into the NHS and to get them registered with the GP. But essentially, if you're in a certain catchment area, you can register with the GP in that area. And there's probably usually quite a few GPs you can GP surgeries in that area that you can register with. But often you have to go to your local health authority or CCG, and they can advise you as to which surgeries are available and who's actually got an open list. So if the list is closed, that means they can't accept any more patients because they don't have the capacity to, but often the list can be open and then patients can come and register.
So one way or another, you will be allocated a GP who will look after you. And, of course, everyone in Britain today, and, of course, we're predominantly talking about England because, of course, Wales and Scotland have their own health services, which are slightly different to those operating in England. So we're probably focusing primarily on the English NHS at the moment. But within a GP surgery, obviously, somebody coming in, most people in Britain and England will have an NHS number, I believe, that then, so that your records can be transferred from one place to another.
Yeah, so when you see a GP, often you see them writing in the computer. In the days gone by, it was all done by paper, but those records are kept with the patient. So everyone's allocated an NHS number. If you change from one area to another and change one GP to another GP, then those records should go with you. Often this could be done quite quickly now because of the fact everything is computerized, but sometimes that's not the case. So you have to be patient, I'm afraid.
And when someone goes to the GP for the very first time, and again, I know most people have been through this many, many times, but it's good to really start from the real basics. So when you go to the GP or you meet a new GP for the first time, what's the kind of conversation that's going to take place?
So first of all, introduce yourself, obviously, and usually what we want to know is what your health is like at this moment in time. So what medications you're taking, what illnesses you have. For example, are you diabetic? Are you asthmatic? Do you have epilepsy? What medications you have? And also with regards to the medication, there's a certain amount of monitoring that goes on with regards to the medication and any side effects you have. So it's usually quite a long, usually need about 20 minutes initially so that the doctor can get to know you, find out what your concerns are and try and alleviate those concerns. But in the background, obviously, try and establish what your current illnesses are and how that would impact on your current symptoms.
We saw the video there about Donald Trump having his physical examination, and you mentioned there about people over 40 are normally invited to an assessment. And, of course, one of the things is that each GP practice will be slightly different, won't they? There's not a set template of how everything will work from one practice to another. So just because it happened in one way where you were, it doesn't mean it's necessarily going to happen the same way at the next place.
No, it can be a bit of a postcode lottery, I'm afraid. So I know that even if I work in a certain area and I work in a different area, there's certain tests that I can request and in one area, but I can't request in another area. And it's all basically down to guidelines, and we have guidelines that we can follow. The CCG, which is the commissioning group, are often involved in those guidelines. And as to what we can prescribe, etc., it's unfortunately not. We can't just prescribe any medication you want, etc. We have to follow the certain guidelines we have to follow. So it depends on which area you're in as to what services are available to you as well. And we're hoping that obviously that eventually everybody gets the same kind of care everywhere in England, but unfortunately, in reality, that's not always possible.
Because, of course, the NHS in England, as in Scotland and Wales, they're made up of different trusts.
Yes.
And of course, those trusts will determine what is spent where, how, and they manage their own.
They have a certain amount of autonomy, so they can decide as to what they can look at what's prevalent in your area, and then try and make sure that the money is available for those services. So maybe in one area you might need people who need to have their diabetes improved. So there might be they might even put money towards health awareness about how to improve your diabetes. So it depends on the locality as well as to what is more prevalent and what funding goes into each project.
Speaking very generally now with the assessment, if you get called in for an assessment, what typically will be assessed, if you like?
So usually if you get called in for an assessment, you'd get your blood pressure done, sometimes your weight and your height. Often your height's recorded. You get your pulse rate monitored. If you have any chest problems, then often the doctor might examine your chest or do your oxygen levels, examine your heart. Sometimes if you're able to give us a urine sample, which I always tell people, before you come and see the GP, do not go to pass urine, do not go to the toilet and pass urine, because you often need a sample.
Yeah.
Because it's quite a simple test we can do in the surgery, and just dipstick to see if there's any, and that actually can pick up quite a few problems, and sometimes we need to action that as well. So.
And how often should that test normally be done?
Well, normally if you're fit and healthy, if you're registering with the GPs, it's important to go an initial assessment. But if you're fit and healthy, we don't often usually do a urine dipstick. But blood pressures, I would say at least get it done once a year. But you don't have to go to your GP practices. There's lots of pharmacists who offer this service, and it's very simple, and they can actually advise you on what a high blood pressure and low blood pressure is.
And it's interesting you say that, because we are going to talk later about a huge amount of things that the pharmacists can do to take the pressure off GPs, which I know you're under immense pressure. And that's actually one of the things that people don't often understand, is why when they go for a checkup or they've got some symptoms of something, which we'll talk about again in a while, but they get seen by maybe the practice nurse or somebody else, not necessarily the GP. And sometimes people aren't actually always happy with that.
No. Sometimes they are, sometimes they're not. But the nurse, or, for example, in one of the surgeries I work in, there's paramedics who will often assess the patients. They're very capable, and they will have the skills to be able to deal with that, with your illness, especially if it's minor illnesses. And if you ring up, I think sometimes it is, I know some people don't want to talk to the receptionist, but it is important to let the receptionist know maybe what your symptoms could be, and then she can channel you to the right person.
And of course, the more information you give, the better the care you're going to get. And as you said, they all sign a confidentiality agreement,
yes,
so
definitely.
You're pretty safe.
Yeah, definitely.
And again, when people come to the surgery, we get this dilemma, don't we, where we get some people who come too often, they almost become regulars, and then you have people who don't go at all.
Yes.
Let's first of all talk about the people who don't go at all, and that tends to be directed towards men. I think generally with the South Asian community as well, that can sometimes happen. Tell us a little bit about the people who don't go enough and their fears and why they don't go enough.
Well, often people can be a bit fearful of seeing health practitioners. So they try and avoid them as much as possible. For example, I had somebody I saw this week who was quite unwell, and he should have really seen us a lot earlier. But unfortunately, he was so unwell that I think unfortunately his wife had to try and bring him into the surgery. Often it's the partners that are encouraging, especially when it comes to male patients as well. I find they tend to avoid us more than the female patients. But it's often their partners who are prompting them, and I often get patients to say, "Oh, my wife told me to come in." But it's really important that if you're feeling unwell and you're not sure, there's also services available like 111 to call these advice lines and get the information that you need, because sometimes you can deteriorate, and that's unfortunately what happened in the case that I saw this week, when a chap I saw had deteriorated and unfortunately needed hospital care.
And actually, again, that's another topic to talk about in terms of referrals and things. So what can we do to get particularly men to face up and get themselves to the GP? Because there's this bravado and a host of different reasons why they don't go. What can we do to encourage them more?
I think it's important to talk about health, really. So often people can find that it's not that interesting a topic, but some people find it quite interesting. So talking about health, even between your friends, between colleagues, and discussing what exactly the experiences have been of other people with GPs, and often people have good experiences, and they've had their symptoms cured, and it's really important to try and get in earlier rather than later, and not let something fester for months and months, because often we can do something about it if somebody comes earlier rather than coming maybe a year later and they've had.
And I liked your advice about calling 111 first, because then you're talking to somebody completely anonymous, and at least you get some indication, because sometimes people are fearful that they're going to get to the GP and they're going to get that look of, you're wasting my time here. Allay our fears on that, because I think generally in speaking to other GPs, you sort of know the people who are the overly visiting individuals and those who actually know that was a valid concern, and I'm glad you came.
Yeah, I think that, I've had patients who never visit, and they said, and I say, oh, why did you not come any earlier? And they said, oh, I didn't want to waste your time. I said, okay, well, I do try and educate them and say next time, I'm hoping it doesn't happen next time, but if it does, make sure you do come earlier, and make sure you tell your friends as well, so at least they know that if it was to happen to them. It can get difficult. Obviously, you have patients who can be quite anxious and they need to attend quite frequently. And they like to tend to see the same health practitioner.
And let's talk about that now, the elephant in the room slightly. The people who come too often, the people who are there for every little cut, graze, sniffle or whatever, how do you manage that to make sure that actually you're dealing with people who really need your help as opposed to those who maybe think they do?
Education, really. I think that's the key role, because I don't want anyone to feel as if they're not being listened to and they're just being dismissed, because then that will avoid them when they really need to see a doctor. They might think, oh, they're just going to tell me I'm wasting their time. But I think education and educating people. So if somebody comes in with a cough or a cold, I often teach them, like if they've got a child who's a bit unwell, and I teach them about what signs to look out for. So if the child is breathing too fast, that's a very important sign, and to make sure that they come in. And then obviously you get the other end of the scale where children are breathing too fast, and you wonder why they haven't been brought in earlier. But education is really key, and there's lots of resources. There's an NHS website which you can read on as well. But if the doctor tells you about an illness, they can often print out a leaflet for you as well, which will educate you on what is wrong with you and what to do in the future as well. And
then that's a very interesting one, isn't it? Dr. Wikipedia.
Yeah.
The self-diagnosis. True. Again, what's your advice to people about looking things up online and almost self-diagnosing?
That's a bit of a worrying trend, mainly because sometimes people Google something and then they will worry themselves and think, I've got this, and this. And some people are just so sure that they have this illness that it's so difficult to reassure them unless they have a scan done. And they're so sure they've got a bit of stomach pains which they've had with diarrhea and vomiting, and they think if they've got cancer. So to try and allay those fears, it can be difficult during consultation. But if the person knows their GP, they know that they're quite thorough and they'll listen to them, and you tell them their symptoms, you can explain to them. And often symptoms can evolve. So you have symptoms, but that can evolve, and then obviously we treat them accordingly. But I would say use Wikipedia or Google with caution, really, is what I would say.
And then call 111.
Yeah, I think it's better to talk to... There's lots of services available. Like we said, 111 pharmacists, even the nurses. Even you can even ask for a telephone consultation with your doctor. And then if you're really that worried, you should actually just ring the doctor, and we can often do telephone consultations which can be dealt with over the phone. Let's
talk about symptoms in terms of, we always say in this show all the time, if you have any concerns about your health, contact your GP or health professional first. What are the sort of symptoms that people should be coming to you for, and what time period for those symptoms actually taking place? So in other words, you said sometimes you just get a twinge and it's gone, and we can overreact sometimes. So what time period should we leave things for, and what are the type of things that actually know you really need to come in and have a chat with us?
Well, it varies according to the person as well. So if somebody who's younger has diarrhea and vomiting, and if you have a child who has had diarrhea and vomiting, hasn't had fluids for more than 6 to 8 hours, we'd be quite worried. Whereas with an adult, we wouldn't be too worried. So it just varies according to what symptoms you have. And I think the most important thing I would say is ringing 111 or speaking to a health professional, a pharmacist, and they can always advise you, because it depends on your symptoms. If you've had stomach pains and it's coming and going, but if it's quite severe, then I would say the severity of the symptoms is very important. So if your symptoms are severe and they're not improving despite using over-the-counter medication, then it's very important to talk to a doctor.
And the thing as well about when you see a doctor, at least you're going to be talking to the professional who knows what they're talking about, as opposed to talking to neighbours, talking to friends, and people all coming up with their own theories about it. And one of the big things that has come out over a lot of the shows that we've been doing is the various screening and things. Now, some of these are done by particular screening processes, some by your GP. Tell us a little bit more about how that works and the difference between male and female screening.
Okay, so there's quite a few screening programs available. We carry out screening to try and detect any illnesses early. So for women, there's cervical screening and there's breast cancer screening, and you often get invited via post to attend your screening test. I think one of the tests, unfortunately, that people do avoid is cervical screening, because they often think it's going to be fine, but it's very important actually it takes about 5-10 minutes for the nurse to do, and you can get if you get a reassuringly positive, a negative cervical smear test, then that can reassure you usually for the next 3 years. It depends on your age range. Breast cancer screening is initiated usually at 50 years old, and you get a screening, and that's obviously to detect cancer. We also rolled out bowel cancer screening, and you get a kit that you get posted through, and it's got instructions on how what to do, etc., and how to give in the samples. And so those are the main screening programs. Obviously, the bowel cancer screening is from both men and women, but breast and cervical cancer is for females.
We have so much more to talk about. It's such a massive, massive area, but we do have to take a break now. But for the moment, thank you very much. And what we should say, as I've mentioned already, that should you suffer from any medical problems or have any health concerns whatsoever, it's always highly advisable and recommended that you contact your doctor or GP, as the Health Show does give you an alternative viewpoint to the health concern being discussed. Now, it's time for a short break, as I said, but don't go away, as when we come back, we're going to be talking more about patient stories and how you can avoid going to the GP and visit your local pharmacist instead, who can help with many of the over-counter medications. See you in a moment. Welcome back to the Health Show, where our topic today is general health advice, where we talk more about one's general health and reasons why patients visit their local GP. Now, often we hear about protests, marches and funding issues with the NHS, as well as GP numbers. Let's take a look at a clip where thousands of protesters marched in London recently in support of England's state-run National Health Service. Marchers were calling for no cuts, no closures, no privatisation in the NHS, with some also concerned about the effect of Britain's withdrawal from the EU and what that will have on the NHS. The demonstrators hope that the march will put pressure on the government before its budget the following week. Let's take a look.
I'm here today really because the NHS is something that affects every single person. Even people who use private healthcare will need emergency services. And I think that once it's gone, it will be too late to get it back. So I think it's really important that we try and turn this around at this point. I think the NHS started at a point when England financially was very poor. It was recovering from the Second World War. There's no reason why we can't, in the world we're in today, still afford it. And I think that everyone has the right to healthcare.
We know from working at the coalface how close to the breakdown the NHS is. My department has large staff vacancies that mean we can't even fill our duty rosters, and if even a small proportion of the EU nationals leave, the service will completely break down. It cannot continue.
We're here today because we're absolutely appalled at what's happening to our NHS. The NHS is being torn apart by the Tories. There's privatisation on the way, and we're not prepared to accept it. The reason why we're not prepared to accept it is because people are losing their lives. A&Es are closing, hospitals are closing, and we can't stand by and watch that happen.
There is enough money in this country. We're the 6th richest country in the world. Corporation tax has just been cut. So we believe that there's actually plenty of wealth in this country. It's not being put into public services. We believe there's the money to solve all of the issues around the campaigns that are here today.
You know, in watching that video, one of the things that we've become increasingly aware of is the huge pressure that the NHS is under. And we certainly don't want to join the debate that the politicians are involved in about funding and so on. But one of the things that we recognise with this pressure is there anything that we, as the general public, can do to at least alleviate that pressure a bit more? So what I'd like to do is maybe a few do's and don'ts when it comes to going to your GP. So let's start off with the positive. So what are the things that we should do when considering going to see our GP?
So do speak to the receptionist and ask and tell her your symptoms so she can make sure you see the relevant practitioner, whether it be a GP, a paramedic or a nurse practitioner. Do turn up on time. That can be quite difficult, unfortunately. Obviously, I know notoriously GPs are known for running late, but often it can be a knock-on effect if somebody's turned up late and then you're waiting for them, and then it can be a knock-on effect. Do make sure you turn up to the appointment. It's very important because the amount of people that don't turn up to appointments is staggering. And actually, even if you can't and you know half an hour before the appointment, ring up the surgery and say, look, I can't make the appointment. Often there is somebody who in the next 10 minutes can come down, in the next 20 minutes can come down and take that appointment. So it's very useful to make sure you communicate with your practice that way. And do try and seek help from other professionals, so like we were talking about, pharmacists, and to try and get rid of the common coughs or colds or hay fever symptoms.
That's something definitely we want to talk about in a moment, is those sort of things where it's sort of a bit borderline, who should I go to for that? So we're going to come to that in a moment. So what about the don'ts when it comes to visiting your GP?
So
actually, you've almost covered it there, didn't you, with by saying do be on time, do turn up, and so on. And obviously I liked your tip about seek other advice first, because sometimes it can be solved by that. And let's talk a little bit now about the pharmacist and the role of the pharmacist, because that's actually changed in recent years, hasn't it? They've become more prominent in the whole process. So tell us exactly what experience they have and what they can help you with, apart from just picking up your prescription.
Yeah, so often you can get pharmacists, especially the experienced pharmacists who have had many years' experience, can understand illnesses, and often they can spot, sometimes they can spot errors in prescriptions. So it's important to try and talk to them when you have simple coughs or colds, hay fevers. They can prescribe you they can not just prescribe, but get you to give you the medications that they think are relevant. For, let's say, hay fever, you can get eye drops, you can get nasal drops, you can get antihistamines. So, and these are all available over the counter. They can also do health checks. They can check I know that there was some pharmacists can check your blood sugar, and they can even check your blood pressure. So often I've seen patients and I've said to them, they've said, oh, I can't get in to see the GP for the next month. So I said, okay, that's fine. I don't have a blood pressure machine. If I need your blood pressure done again, then I'll say, oh, okay, then we can pop to your local pharmacy and get
that's
them
a great
to
thing with the
document.
pharmacies, aren't they? Because they're open for such long times.
Definitely.
You can usually get in quite quickly. And, of course, these are qualified health professionals. So they will, I presume, they'll always tell you if it's suddenly starting to get out of their remit.
No, I know some pharmacists quite well, and they'll definitely, if they will probably err on the side of caution and advise you to see the GP, and often they'll give you the information that they've given you and told them, look, I'm telling you to see the GP because of this, because of so-and-so, you've tried this medication, that medication, and it hasn't helped. So they might give you a cream if you've got a slight irritation on your skin, and if it doesn't get better, they can often advise you when to see the GP.
And in terms of the dreaded coughs, colds, the seasonal symptoms that we see here every winter in England, and especially the seasonal flus, just tell us a little bit about flu jabs. Who should get them? Do you need to go to your GP or should you go somewhere else?
Well, certain criteria that we have as to who is eligible for the flu jab. So often people who have other illnesses such as diabetes, lung diseases, asthma, they're eligible for a free flu jab, and if you're over a certain age you can have the flu jab. Usually you will get, I've seen the poor receptionist ringing everybody up trying to get them in for the flu jab, but there's always posters up as to when flu jabs, when they will be available, and often there'll be a weekend when the surgery is open and all they'll be doing is flu jabs. The unfortunate thing is then you can't often discuss what other problems you have, but opportunistically if you do a flu jab and you're in the surgery for something else, then usually they're quite accommodating, and they prefer you to have the flu jab to try and avoid you getting the flu in the first place, which, you know, it can take quite a few days off your working life if you're busy at work. You can
and not to mention spreading it to more vulnerable people.
Yeah, definitely, because the more and often I find people don't rest, is what I realise. So the more you carry on and you don't rest, the worse it can become. And it's really important when you do have flus, the aches and the fever and the cold and the cough, to try and get that rest. Because if you do not get that rest, then obviously you will get worse, which is often happens.
And that's a big debate, isn't it, about how much rest? And actually there's been very recent studies, haven't there, all about how actually getting rest does contribute to a quicker, speedier recovery. So actually in the long term, you're better off taking that bit of time off. What about rest through coughs, colds, medications, over-the-counter medications versus seeing the GP? Where's that balance lie?
So you can get simple cough syrups and cough linctuses from your pharmacist. Often GPs don't really prescribe cough syrups. We will examine you and usually tell you if it's a viral infection. You can just buy some cough syrups over the counter. But if you have a cough and it's lasted for more than 4 to 6 weeks, then we do, especially if you're a smoker, then we are a bit more concerned. Then I would advise you to see your GP, because people who've had a cough for more than 6 weeks, we often do a chest X-ray. The guidelines that we usually follow, especially if you're being a smoker. Some people who have asthma often have chronic coughs, but if the cough has changed in any way, if you're bringing up phlegm sometimes, especially if it changes colour to yellow or green, or if there's any blood in that phlegm, then it's very important to see your GP. If you're getting night sweats or weight loss, very important then to discuss this with your GP. You can, in the initial stages, in the first week, you can go to your pharmacist and get the advice and that they would probably give you, but if it persists, I would say definitely come and see us. And
there's extra sensitivity when it comes to the vulnerable people in our society, the pregnant mothers, children, and of course, for that matter, the elderly. Yeah, definitely. And also people who have who are immunocompromised. So people who have cancer, often they're having chemotherapy or radiotherapy, and unfortunately that obviously suppresses their immune system. So you have to be careful with these patients too, or if you're on certain medications that can alter your immune system. Sometimes there's medications that you're on to try and help you, but unfortunately you have to have regular blood tests to make sure that they don't suppress your white cell count, which you need your white cells to try and fight infections. So they're
it's important those people come and see us.
We talked earlier on about the difference between men and women going to see their GP, the reluctance of men. And I'm just thinking about our audience of this particular show and if there are any cultural differences in terms of attitudes towards going to get help and seeking the advice from a GP.
I mean, from my personal experience, I've noticed that often when I see female patients, especially if they're ethnic minority, they tend to prefer to see a female doctor. And often, if I might see a male patient, they will often ask, even for their family member, when do you work? What hours do you work? So I can make sure that my wife or mother or sister comes and sees you. So, and they can often relax, and they find that it's easy to relax. And now there are a lot of female GPs, so often it's quite easy to get an appointment with a female doctor. When it comes to men, I find the same thing. I think just it doesn't matter about ethnicity. They tend to avoid coming to doctors. I mean, obviously there'll be exceptions to every rule, but I found that they tend to avoid coming to doctors, and they leave things when, unfortunately, symptoms have evolved. So it's important to go early, not leave a cough for 8 months and then come and see us.
And again, this concept of female GPs being available, would I be right in suggesting that actually any woman who wants to, regardless of faith or ethnicity, but just actually says, I want to see a woman, if they go to any practice, that will be listened to and they will do their absolute best to make sure that's possible?
Yeah, for any illnesses. I mean, some people find it easy to talk to a female GP about certain issues, but if anybody wants to see, if there's any woman who wants to see a female GP, then that should be available. If not, often there's nurses, and you can always discuss with the nurse, and then she can discuss with the doctor if you really aren't happy talking to a male doctor. So there's all the surgeries that I've worked in the past, I've always had female GPs, obviously me being one of them as well, so and often in demand. So
Now, one of the things we talked about earlier on was about referrals, because obviously the nature of being a general practitioner, you cover a massive area of healthcare. So when it comes to specific needs, you then refer people if it suddenly becomes necessary. Explain how that process works.
So maybe if I use a case study, so let's say I have a patient who comes in who feels dizzy. So often that's quite a broad symptom, and it can mean a lot of things. So what I will do is I will try and find out exactly how the dizziness came on, exactly how it gets worse and what happens, and ask about any other symptoms they could be having, anything related to their heart, their chest, any fits or faints or loss of consciousness, and do thorough examination, which includes a blood test. Often when you're dizzy, it's not a good idea to drive. Well, you shouldn't be driving. So I'll give them that advice and do the blood pressure, and then sometimes when you've assessed them, I can establish why they get the dizziness. I had a patient who, when they moved the head from side to side, they would get dizziness, which was after I did all the examinations. I knew from the history, from what they said, that this sounded like it was a bit of labyrinthitis or benign positional vertigo, which is an illness which essentially involves the middle of the ear, and it's to do with your balance centre. And it's quite easy for a GP to even do certain manoeuvres to try and help you or give you information on certain exercises you can do. So, but if it was something that I thought the dizziness I could not deal with, and I've done the investigations, the blood tests and ECG, etc., and it's come out negative, then sometimes you do need to be referred onwards to have that investigated further.
And again, as you say, there's people to do that. And I know one area you're particularly keen on is looking after your heart, looking after your blood and so on. And we've seen quite a lot recently on TV, what to do if you're thinking that somebody's having a stroke or someone is having heart or breathing problems. Maybe it's a good point here to reiterate some of those guidelines.
Yeah, so if you think somebody's having a stroke, I think there's a good acronym that's on the advert. So anybody who's getting any slurred speech, any weakness down their side, it's an acronym ACT FAST. So if they get any facial paralysis, so it's really important that you call 999, because what we can do now, like we used to do with heart attacks, and this is what happens now, is that somebody gets seen straight away and they get assessed. We try and get them assessed within hours, literally, and try and get the medication in, because often strokes are due to blood clots, and to try and get rid of that blood clot, the quicker you get rid of it, the quicker you treat the blood clot, then the quicker the person makes a recovery. Because with strokes, unfortunately, they can be quite debilitating, and you're left with a lot of residual effects, and you need a lot of rehabilitation. So acting fast is very important. And it's the same as if somebody was to have chest pain, and that's a bit of my bugbear, I'm afraid. I do have patients who have had chest pain for several days, and I often ask them, oh, why did you not go to hospital? And they said, oh, I didn't think it would be that bad. And often I end up having to send them into hospital. So with chest pain, we take that extremely seriously, especially you're getting chest pain on the left side, and it's going into the arm, or you're getting any nausea or vomiting with it, any dizziness. I think it's really important to call 999.
But that's what I was going to say. There are times when actually waiting for a GP's appointment isn't necessary.
No.
You do need to take, as you say, fast action to get diagnosis from, a hospital.
Yeah, this is when it comes back to you telling the receptionist. So often I've started surgery, and the receptionist, I can see what people are coming in for. And I spotted maybe 2 hours, I was going to see a patient in 2 hours' time. I saw that they had chest pain, so I thought, okay, before I even started surgery, I thought, okay, I'm going to ring this person. Rang the chap up. I said to him, okay, you've got chest pain. Spoke to him. I said, okay, this doesn't sound very promising, but you need to go into hospital straight away. So that's just going to show how important it is when you do talk to receptionists and telling them about your symptoms. And then we were able to get him the treatment more promptly than him having to wait 2 hours. And 2 hours is quite a long time when you've got chest pain.
Absolutely. And of course, one of the things you were talking earlier on about, be patient when you go to a GP practice, because, of course, the person before you might need a longer consultation than you.
Emergency
and at the end of the day, this is a service that we all need to try and work together with to help each other.
Definitely.
Now, funding obviously is a massive issue.
Yes.
And I know there are things that we can do, as we've talked already, to actually help with that process. This whole concept that you talked before about it being a bit of a postcode lottery, again, if you're not happy with a particular practice because maybe you feel they're stretched, how easy is it to move to another one?
It's quite easy. You can, as long as you are in the catchment area, or they are registering patients, then you can just go to another GP surgery and ask to see someone there. Sometimes you have multiple GPs in one practice, so I always advise, if you're a bit concerned about something, then always get a second opinion. And if you're not happy with what in the same surgery, if you're not happy, you can always get a second opinion, and take it from there, is what I say. You don't necessarily have to change practice because of that one issue, because it might be a practice that's convenient to you and that's local to you, but there's often several GPs, and you find that maybe you can discuss with one GP, and they will think of a different management plan to another GP, because maybe you've been able to open up maybe to one GP than you can to another.
You talked at the very beginning of the show about that you're passionate about being preventative about healthcare, not just reactive.
Definitely.
So let's look into some of the education that you do, because one of the things that we're very aware of, we've seen it on the news all the time, or hopefully most of us are aware of, is nutrition and what we eat. How much help and advice is available at your GPs to guide you on the path of a healthier diet and a healthier lifestyle?
The nurses are very educated in this. Obviously, 10 minutes with the GP isn't usually enough to discuss this. So the nurses have often been given training, and they often are happy to sit down and talk to people about the nutrition. I always tell people, do a food diary, and you can see what you've been eating, and including drinking as well, what you've been eating and drinking over the last few days, and be truthful, obviously, and then bring that in, and then we can assess what your normal habits are, and then try and change those, because I can tell you, do this, this and this, but often people will know the information, but they won't change. But doing a food diary, we can tell you, look, you can substitute this for that, and try and make it more tailored towards you, as opposed to just getting some generic information from.
I really like the idea of where you can look at someone's food diary and say, well, that's not quite so good, but if you use that instead, so you're giving swap real alternatives.
Something practical, because you often get like shows you'll see, and you think, okay, why don't I just? I know know I'm meant to cut down on my sugars, cut down on my fats, not smoke, not drink alcohol. I think most people know all of this information, but it's just tailoring it to you. So I have people who are lifelong smokers, and I want them to stop smoking, but I'm realistic as to what they can achieve. So I often say to them, look, why don't you just cut down? So if you're having 20 cigarettes, can you cut down to 10? And they're often quite reasonable and say, yeah, I can cut down to 10. So at least that's a change that is practical, and it's something that the patient can do, as opposed to being told, oh, you should stop smoking. I think you have to tailor it according to what the patient can do practically. Often they're stressed and they say, look, I can't cut down right now, so just cut down by 1 or 2, and that still makes a difference.
One of the telltale signs is cholesterol, and that's a test that you do, isn't it?
Yeah, it is. It's a fasting blood test. It's to get an accurate blood test, and you usually have to fast overnight. What you eat the night before can often have an impact on your cholesterol, but if that's what your normal diet is, then it's important that we know.
Don't suddenly really healthy. Yeah.
Because then we need to know what you're normally eating, and then try and advise you on changes. And when you do have a cholesterol blood test, there's quite a few parameters in that blood test. So there's quite a few things we look at. We look at your good cholesterol, your bad cholesterol, look at the ratio between the two, and then it can advise you according to that. If you need to have medication to try and lower your cholesterol, we'll do that according to your weight, your past medical history, your blood pressure. So it's not just your cholesterol is high, you should be put on medication. We try and avoid medication if you don't need it, because often there can be side effects. But if you do need it, then it's usually we've done something called a Q risk score, which quantifies the risk of you getting a heart attack, and then treat you according to that.
Finally, we've just got about 30 seconds left. I just want to have a final tip from you, or a couple of tips maybe, about how to get the most out of your GP and how to support your GP and what they do.
So I think do listen to your GP. If your GP is advising you on certain treatments, then I'd advise you to listen to them. Also, try and access other professionals. Like I said, nurse practitioners, nurses, paramedics, pharmacists. Speak to the receptionist. You can always have telephone consultations as well. So try and ease the pressures of the GP. So I think everybody knows how busy we can be. So.
Very well put. That's fantastic advice. Yeah. Thank you so much. And it's great to hear that there is, despite what we sometimes hear on the news, there is a lot of help available out there. Oh,
definitely there is.
So thank you very much indeed.
Thank you for having me.
But unfortunately, that is all time we've got for. But I would like to thank our guest today, Dr Nazia Rashid, who's done a great job with us today, a general practitioner who's come into the show to discuss the importance of visiting your GP and how we can all maintain good health by having regular checkups. Now, once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like any more information about this or any of the subjects or any of the programmes we've discussed, then please do email us at healthshow@islamchannel.tv. We would really love to hear from you, so please do get in touch. But for now, it's goodbye from me, and see you next week. Thank you so much indeed. Assalamu alaikum.